Approved use. Austeto is a prescription medicine that is used to treat adults with movements in the face, tongue, or other body parts that cannot be controlled, tardive dyskinesia. It is not known if Austeto is safe and effective in children. Important safety information. Austeto can cause serious side effects in people with Huntington's disease, including depression, suicidal thoughts, or suicidal actions. Do not start taking Austeto if you are depressed, have untreated depression or depression that is not well controlled by medicine, or have suicidal thoughts. Pay close attention to any changes, especially sudden changes in mood, behaviors, thoughts, or feelings. This is especially important when Austeto is started and when the dose is changed. Call your healthcare provider right away if you become depressed, have unusual changes in mood or behavior, or have thoughts of suicide. Do not take Austeto if you have Huntington's disease and are depressed or have thoughts of suicide, have liver problems, are taking a monoamine oxidase inhibitor (MAOI) medicine. Do not take an MAOI within 14 days after you stop taking Austeto. Do not start Austeto if you stop taking an MAOI in the last 14 days. Ask your healthcare provider or pharmacist if you are not sure. Are taking Respirine. Do not take medicines that contain Respirine, such as Serpilon and Renes R with Austeto. If your healthcare provider plans to switch you from taking Respirine to Austeto, you must wait at least 20 days after your last dose of Respirine before you start taking Austeto. Are taking tetrabenazine, xenazine. If your healthcare provider plans to switch you from tetrabenazine, xenazine to Austeto, take your first dose of Austeto on the day after your last dose of tetrabenazine, xenazine. Are taking valbenazine, Ingrezza. Other possible serious side effects include irregular heartbeat, QT prolongation. Austeto increases your chance of having certain changes in the electrical activity in your heart. These changes can lead to a dangerous abnormal heartbeat. Taking Austeto with certain medicines may increase this chance. Neuroleptic malignant syndrome. Call your healthcare provider right away and go to the nearest emergency room if you develop these signs and symptoms that do not have another obvious cause: high fever, stiff muscles, problems thinking, very fast or uneven heartbeat, or increased sweating. Restlessness. You may get a condition where you feel a strong urge to move. This is called akathesia. Parkinsonism. Symptoms include slight shaking, body stiffness, trouble moving, trouble keeping your balance, or falls. Sleepiness, sedation, is a common side effect of Austeto. While taking Austeto, do not drive a car or operate dangerous machinery until you know how Austeto affects you. Drinking alcohol and taking other drugs that may also cause sleepiness while you are taking Austeto may increase any sleepiness caused by Austeto. The most common side effects of Austeto in people with Huntington's disease include sleepiness, sedation, diarrhea, tiredness, and dry mouth. The most common side effects of Austeto in people with tardive dyskinesia include inflammation of the nose and throat, nasopharyngitis, and problems sleeping, insomnia. These are not all the possible side effects of Austeto. Call your doctor for medical advice about side effects. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information about Austeto, please see the medication guide available at austeto.com or by calling 1-800-887-8100.